And topping our healthcast today, there's a new treatment option for people living with the most common form of chronic blood cancer. Dr. Jacqueline Barrientos, who's the director of oncology research at Mount Sinai Medical Center, says there have been real great advancements in a class of drugs known as B.T.K inhibitors. They're used to treat chronic lymphocytic leukemia, or CLL. A second-generation B.T.K inhibitor is called zanubrutinib, and it was recently approved as another frontline approach to the disease, but it's less toxic.
So we're very excited, especially because there are data also that support that if you are in one drug and then you cannot tolerate it because you develop side effects, which can range from headaches to GI discomfort or muscle aches, you can actually go to a second generation between both of them and really well tolerate and still have good responses. So that's what is important for us, having a choice.
The doctor goes on to say another newer type of B.T.K inhibitor is improving the treatment of patients with relapsed CLL. According to the American Cancer Society, this particular disease accounts for 1/4 of all new cases of leukemia in the U.S. right now. And there are some disturbing news, some information coming to us from a new study by the Journal of the American Medical Association. The death rate of children and teens in the U.S. actually surged during the height of the pandemic. Researchers say the number of kids dying increased nearly 11% in 2020 and 8% in 2021. That would be the largest spike in decades. The study says the rise in deaths were not driven by COVID-19 at all, but rather by fatal injuries from things like guns and drugs and cars.